Now we'll move on to the online quiz for students. For day 2, we had the day 1 quiz yesterday, which was based on yesterday's abstracts. And today, the day 2 quiz will be held for students who have joined online via the app. So till the app is logged in. Project kar do. So we wait for a few minutes till more students join.
Okay, ma'am.
So for those students online, you can either download the Kahoot app and enter the game pin, which is on the screen, that is 3769981, or you can scan the QR code and log on to the quiz. So please do it within the next 2-3 minutes. We plan to start the quiz after that. So please log in onto the app quickly. We'll start in the next 1 minute. So we'll start now. Can I request to start the quiz? So the quiz will have 20 questions, each with it's a multiple choice with 4 options, and like those who participated yesterday, you have to select the right option on the Kahoot app. So the first question is, which of the following drugs were evaluated in the LightSpark 005 study? And there are 4 options: PDL1 antibody, HIF2A inhibitor, a VEGF TKI, or an AKT inhibitor. So we have 5 correct answers and no, I think 3 correct answers, which is the HIF2A inhibitor belzutifan, which was evaluated. And then we go on to the next question. So the highest scorer is Harshit Rewari for this, and followed by 4 others. So moving on to question 2. Which of the following conditions associated with renal cell carcinoma in hereditary fumarate hydratase deficiency, that is FH deficiency? The options are liver hemangiomas, uterine leiomyomas, pancreatic cyst, pleural mesothelioma. So your time is, the countdown is on. So pick the right option. So the right option is uterine leiomyoma, and 6 have got it right. So let's look at who's leading in scores now. Again, it is now Dinesh who's leading the scores, and we'll move on to the next question, question 3. What was the median overall survival in the nivolumab ipilimumab arm in patients with intermediate IMDC, intermediate poor risk checking RCC checkmate 214 study? So the median overall survival was 34 months, or 62 months, 46 months, or 28 months. So the right answer is 46 months, and 4 of the participants have got right. So let's look at the scores now. So Dinesh maintains the lead, and Ashok, Mehak, Monique, and Harshit are not far behind. So with this, we go to question number 4. Which of the following combination has shown an improvement in progression-free and overall survival in the first-line unresectable or advanced urothelial carcinoma setting? So we have 4 options. One is gemcitabine cisplatin with pembrolizumab. The second option is gemcitabine carboplatin with pembrolizumab. Third one is gemcitabine cisplatin with nivolumab, and the fourth is gemcitabine carboplatin with nivolumab. So you have 4 options. Please pick the right option. I think we have 10 seconds to go. So it looks like most of the participants got this one right. It is gemcitabine cisplatin and nivolumab. The 11 of 15 have got it right, and let's see who's leading the scores now. So the highest scorer now is Ashok, and followed by Dinesh, and then Sandeep. We move on to question 5. Enfortumab vedotin is an antibody drug conjugate which targets which of the following antigens? That is 4 options: Nectin-4, TROP2, GATA3, or tissue factor. So the right answer is Nectin-4, and a lot of people have got it right. Let's look at the scores at this point. Ashok is still the highest scorer, and then Dinesh and Sandeep follow. So let's move to the next question. Question 6 in the quiz is, in the trial for adjuvant pembrolizumab in clear cell RCC, that is the keynote 564. So what was the, actually the question is, there's a typographical error, but what was the time frame that was allowed for resection of the Mets after a nephrectomy in the group of patients who were M1 NED? That was 6 months, 12 months, 18 months, or 24 months. My apologies for that typo there. But in the M1 NED group, what was the time frame that was allowed for the patients to undergo a resection of the metastatic sites after the nephrectomy? So 7 have got it right. It is 12 months. So let's look at the scoreboard now. So Ashok is still leading and Sandeep is close second. Let's go to the next question. So what was the 5-year overall survival in poor risk NSGCTs in the last IGCCG consortium update? So there are 4 options: 59%, 78%, 44%, or 67%. So 67% is the right answer. Only 5 have got it right. Let's look at the scores. So RR leads with over 4,000 points. And now we'll move to the next question, question 8. Which of the following FGFR gene mutations is commonly altered in urothelial cancer? So FGFR3, the second option is FGFR2, third is FGFR1, and the last option is none of the above. So the right option, the most common FGFR alteration, is FGFR3, and 7 have got it right. So go on to the scores. So Ashok is leading, and we go on to the next question, question 9. As per the AU definition for a positive node, the size of the pelvic node and abdominal nodes should be, this is for urothelial carcinomas or bladder cancer, a pelvic node size of 8 millimeters and abdominal nodes for 10 millimeters in the long axis, a pelvic node of 10 millimeters and abdominal node of 8 millimeters in the long axis, a pelvic node of 10 millimeters and abdominal lymph node of 8 millimeters in the short axis, and a pelvic node of 8 millimeters and an abdominal lymph node short axis measuring 10 millimeters. So the right answer is option D, that is pelvic lymph node of 8 millimeters, or if it's an abdominal node, 10 millimeters on the short axis. 2 have got it right. And let's look at the scores. So RR leads, and he has a streak with 7 correct answers in a row. So we move on to the next question, question 10. So which statement is true regarding bladder sparing radiation in the study, in the bladder sparing radiation study? So 1, it's a prospectively collected data. 2nd, it's a randomized control trial. 3rd, they included patients only with bladder confined disease. And the last option is there was equivalent survival outcomes in the radical radiation group compared to the cystectomy group. So the right answer is option D, that is equivalent survival outcomes in the radical radiation and the cystectomy groups. 8 have got it right. Let's look at the scores. So RR still continues his winning streak, that is over 6,000 points, and Ashok is a close second. We'll go on to the next question, 11. In the trial for chemoradiotherapy in locally advanced penile squamous cell carcinoma, which of the following is not true? So we have to look at the statement which is not true. A, it is a prospective study. The second option is the radiation dose to the gross primary and nodal disease was 59.4 grade in 33 fractions. The 2-year overall survival was 12%. And the last option is there was no grade 5 toxicity report. So the correct option is in the study, 2-year overall survival was reported as 12%, and 4 have got it right. So we'll move to the next question. So RR is still leading, and let's go on to question 12. This is the question on what was the primary outcome measures in the E-block study. So the first option is recurrence-free survival. The second was detrusor muscle in the specimen. Third is operation time, and fourth is bladder perforation rate. So the correct answer was the outcome measure for the study comparing the en bloc resection of the tumor as compared to the standard during TURBT was the presence of the detrusor muscle in the specimen, and 5 people have got it right. We look at the scoreboard now. So RR is still the highest scorer, and we go to the next question, question 13. So what was the primary endpoint of the study which looked at the radical cystectomy in comparison to trimodality therapy? So first option is overall survival. Second is disease-free survival. Third is cancer-specific survival, or the last one is metastasis-free survival. So the right answer was metastasis-free survival, and 3 people have got it right. So we look at the scoreboards now. So Sandeep is the highest scorer, and RR is second, followed by Ashok. And we go on to question 14, the next question. So this is which patient characteristic was not a factor in the eligibility for participation in the DABLA-CAS 13 study, which means which was not a eligibility criteria or an exclusion criteria for including patients in the study. One was history of BCG treatment. Second option is presence of an invasive or a solid tumor. Third is acute cystitis, or the fourth option is age of the patient. So the right option was patient age. So they did not exclude patients on the basis of age, and only one has got it right. And we look at the score now. Sandeep was leading, and now he still is in the leading position. So go on to question 15. So what was the primary endpoint of the study comparing radical cystectomy and trimodality therapy? A repeat question. Anyway, it's a repeat question, but it's metastasis-free survival. So let's go to the next question and look at the scores. So this is again on the radical cystectomy versus trimodality study, and which of the factors was not significantly different between the groups after a propensity score matched, that is between the radical cystectomy and the trimodality group. 1 is age, 2 is sex, 3 is clinical T stage, and the last is the receipt of neoadjuvant or adjuvant chemotherapy. So the correct answer was clinical T stage. There was no difference in the T stage of patients included in both these groups in the study, and one person has got it right. We go on to the next question, question 17, and have a look at the scores as well. And Sandeep is still the highest scorer, so followed by RR and Sagar. Question number 17. So ELND, what impact did it have on the overall survival compared to SLND according to the SWOG S1011 trial? So 4 options. 1 is it improved OS. Second, reduced OS. third did not impact the overall survival, or the last option is the study did not look at at OS amongst between the groups. So the correct answer is it did not impact the overall survival, and most of them have answered it correctly. So let's go on to question 18. Sandeep is still leading, followed by RR. Question 18, please. So based on the same trial, what do we conclude? Based on the findings of the SWOG S1011 trial, we can conclude that either A, ELND should be avoided due to high complication rates. The second option, ELND should be implemented universally for its node yield benefits. Third option, ELND may be considered for its diagnostic rather than therapeutic benefits. And the fourth option is that ELND has a clear therapeutic benefit over SLND. So option 3 is the correct option. It may be considered for diagnostic rather than therapeutic benefit. And five of the participants have got it right. So we quickly go on to the scores and the last two questions. Sandeep is still leading, and we'll move to question 19, please. So in the study which looked at gemcitabine docetaxel as intravesical therapy compared to BCG, in this study which compared sequential gem dosi versus BCG in high-risk NMIBC, which of the adverse event was more common in the gem dosi group? 1 is dysuria, 2 is bladder spasms, 3 is arthralgias, and the last option is hematuria. So bladder spasms are more common in the gem dosi group as compared to the BCG group, and 4 have got it right. So look at the scores, and now it's the last question for the quiz for today. Sandeep is in the lead, followed by RR. He is a close second, and third is Sagar. So question number 20, and then we have the final scores. So this is what aspect of recovery did a robotic RAR IUD not improve as compared to an open surgery, that is an ORC. The first option, time to mobilization. Second is post-op pain levels. Third is nighttime continence recovery. Fourth is early discharge from hospital. So which was not improved by the use of robotic? So most answered it correct. It is nighttime continence recovery. It did not significantly vary between the groups. And with this, we finish the quiz and we'll have a look at the final scores. So on third place with 8,500 points, with 11 questions out of 20 is Sagar. Congratulations. Second place is RR, that is more than 9,753 points. And the winner for today's quiz is Sandeep with the 10,886 points and 13 out of 20 correctly answered. So congratulations to the top 3, and thank you for all the students who participated both in yesterday's and today's quiz. Thank you very much.